WVUA 23's Ivy Irvin went to the University of Alabama Student Health and Wellbeing Center to find out how the university is handling their students' mental health. Ivy?
That's right, Tamika. The University of Alabama at Birmingham has been increasing their student counseling services for the past 5 years, and they don't plan to stop anytime soon. The University of Alabama says that they are following suit. The University of Alabama at Birmingham recently released statistics saying 36% of their students report feeling too depressed to function, and 50% say they felt things were hopeless within the last 12 months. 10% thought about suicide, and 3.3% attempted suicide. These numbers are why they've doubled their number of counselors over the past 5 years. Dr. Tody Perez, the new Associate Vice President for Student Health and Wellbeing at the University of Alabama, says those numbers reflect the college trend nationally, and that he notices more of a need for mental health resources each year.
I think each year we see an increasing number of students coming for counseling, presenting with a number of different concerns.
And the main concerns from college students are depression, anxiety, and stress. Each of these conditions can come from your typical college experience.
From starting school for the very first time, to test-taking anxiety, to relationships, to some more chronic and more serious concerns related to anxiety and depression.
Dr. Perez says that students tend to turn to their friends first when they're feeling helpless, and that's totally fine. But he wants everyone to remember the multiple resources that the campus offers.
We have our counseling center. We have the psychology clinic that also serves students and the public. We have our Women and Gender Resource Center. Lastly, we also have our Student Health Center with our psychiatrists who can help evaluate students in need for medication.
And of course, if you're worried about someone's safety, don't hesitate to call 911. Dr. Perez says if feelings of anxiety or stress start to affect a student's social life, grades, or relationships, they should reach out for help.
One of the things that's important is for students to also not hesitate to ask for help when they need it.
Dr. Perez recommends if you're feeling helpless or depressed to reach out to someone you trust as soon as possible. And know that all of UA's mental health resources are inexpensive and will work with you in any way they can to help. Reporting live, I'm Ivy Irvin, WVUA 23 News.